Picture this: a physician in Santa Barbara coming home after a day of seeing patients in a well equipped, comfortably air conditioned office. They put on comfortable clothes, they eat dinner with their kids, do the dishes, maybe consult on some homework and weekend plans, and then open up the laptop and do a completely different kind of consulting. If they're a pediatrician, they could be consulting on children in Cambodia. If they're an oncologist, they could be helping with chemotherapy protocols in Kenya. This may sound like sci fi, but thanks to technology developed in Santa Barbara and the philanthropic vision of Dr. Yulun Wang, the pioneering inventor of surgical robotics and World Telehealth Initiative CEO Sharon Allen, physicians from all over the US and beyond are now able to provide medical expertise to vulnerable communities all over the world with just a few keystrokes on their computers. 15 million additional healthcare workers will be needed by 2030 to meet the demands of the global population. Hello, I'm Tej, host at Chezuba Talks. As I research nonprofits and the work that they do, it never ceases to amaze me how much and how little can be done to help humans or animals or Earth to make this a beautiful world. And yet, in our everyday lives, we tend to fret over the most insignificant of things. I have Sharon Allen, the CEO of World Telehealth Initiative. Sharon is a recognized leader in international philanthropic telehealth, is often invited to speak at conferences, including the American Telehealth Association, the White House Telehealth Innovation Summit, Nigeria's Healthcare Today, where she was a keynote speaker, MENA Telehealth Conference, Telehealth Innovators Forum, the Global Health Summit, and so many more. She has traveled extensively to understand the needs of low resourced healthcare clinics and hospitals worldwide. Under her leadership, WTI has developed an innovative model that leverages remote philanthropic physicians to provide sustainable medical expertise via telehealth. Sharon has been selected to serve on the World Health Organization's Digital Health Board of Advisors and roster of experts. She is currently working with WHO on their telehealth roadmap for the underserved. Welcome, Sharon. Such a privilege to have you on Chezuba Talks.
Thank you so much, Tej. It's my pleasure to be here with you today.
I am in August company. It is just amazing to be just in your presence. So, Sharon, can you provide an overview of how WTI utilizes technology to deliver healthcare services?
Absolutely. So we recognize the need to provide access for half of the world that doesn't have adequate healthcare access. And as is common knowledge now, technology simply has to be part of that solution. So we are incredibly fortunate that we partner with Teladoc Health, and they donate not only their network access, but this high-end medical grade equipment that can be diagnostic enabled. So they donate these devices to us. It's called an
Mhm.
RP Lite, and that stands for remote presence because a provider from anywhere in the world can beam into this device that's in a clinic or hospital and provide their knowledge and expertise to our partners on the other side. So the technology, has incredible magnification of the cameras. So my whole screen could be the pupil of an eyeball, and I could see it to that detail. It can be attached with diagnostic devices, anything from a stethoscope, where I then can hear a patient's bowel sounds or heart sounds, in my headphones, across, oceans away. or we use a lot of ultrasound technology in our maternal health programs, or we've even used intraoral cameras for a dentistry program in Guinea. So the technology is the highest available, and is so powerful that allows us to do the work with our partners.
That is amazing. I can't imagine seeing in such detail and being able to consult and diagnose issues. That is just amazing. And do you need to have both the partners having the same kind of technology there, or is it possible that underserved areas will not probably have the same technology?
So in our programs, the way it works is we donate that light device to the clinic
Ah,
or hospital that we're working with,
okay.
and they have it there, and we have full responsibility for keeping it updated and maintained, and we would
Maintenance.
send
Hmm.
parts if they need them. Now, from anywhere in the world, a supporting physician would just beam in from their laptop or their desktop, even their iPhone or an iPad. So they just push a couple of buttons and voila, they're across the world helping their colleagues on the other side.
Wow. How many such units do you have, if I may ask?
So we are currently at 42 programs, 42 communities that we're supporting in this manner. And there's many more in the pipeline. So we are just, expanding, constantly as we move forward.
Wow. So I'm very excited about this fact that do you have physicians who come to you voluntarily, or do you approach the physicians?
When we started this model, Dr. Wong and I discussed how will we recruit these physicians. But as it turns out, physicians are very philanthropic, at their nature. And so now we've seen studies that say 80% of physicians would love to contribute meaningful volunteer activities. So, but oftentimes they don't, they can't necessarily go on a medical mission that takes, weeks away from their job and lots of money
True.
and vaccinations
Yes.
and planes and all of that. But if they're given the opportunity to simply open their laptop in the situation that you explained at the outset, where maybe after a long day of work, they could just open that and boom, they're in Bangladesh consulting with their colleague on maybe four complex cases. And so it is so easy to contribute that knowledge that they took a long time to acquire and want to
Hmm.
share it.
Hmm.
So now we actually have thousands and thousands of physicians that want to join our efforts. So we're working now to scale our efforts because the more healthcare providers we have, the more medical healthcare needs we can support.
Absolutely. So when we say these physicians are coming to you and they help out, now the other end, the underserved end of the deal, so to say, but will need some accessories, will need some post care, will need the services that have been recommended. Now, these support services need to be available at that unit. Is that part also taken care of by you, or the partner organization takes care of that aspect?
So the way that that works is when we're onboarding a new partner site, we have some orientation meetings with providers that will be supporting that location and the host on-site providers. And they have discussions about, what kind of um, labs are you able to run at your facility? And typically I may prescribe this medication. Do you have that available? Or what would you prescribe? And so over time, they actually get to know one another quite well. And some
Mm-hmm.
of our supporting physicians even have gone to the location to meet their colleagues that they're supporting and see the community where they're engaged. And many of them are also diaspora of the country that we're working in. And so that's a beautiful
Ah,
fit. But it's
yes,
through dialogue and, providing that information to our supporting providers so they know what the constraints of that location are.
location is, yeah.
Right. So it's definitely a very deep collaboration that then enables the advanced healthcare that they jointly work on together.
True. So a lot of groundwork goes into actually setting up the collaboration and then making, executing it.
That's right. We really foster these relationships and then they kind of grow from there.
Right. Is there a certain kind of criteria that a collaborating organization needs to fulfill in order to be part of your program?
So we definitely vet all of our healthcare providers, in order for them to participate. We want to be fully transparent with our on-site providers. Are they licensed? Are they board certified? And we do have some retired providers that maybe
Hmm.
aren't licensed, but and maybe they do didactic sessions and they have extreme value, and we want to capture that. So we do a thorough vetting process just to make sure that, and we have some of the world's top experts that are engaged with our program. So we just want to make sure that our site partners, when they're selecting who they would like to work with, that they are very aware of the various qualifications of our providers.
Wonderful. So this is very rewarding, I can see.
Let's take a break to understand what Chezuba is. Everyone at some point ponders on how this beautiful life can be made more meaningful. Maybe you're a leader trying to enhance your employees' experience at your organization. Or you already work for the community and seek volunteers with state of the art skills to strengthen your nonprofit. Whatever your situation, know that you can make a difference. Chezuba began with this very vision, a vision to facilitate every skill and every passion in the world in meeting a social need. Corporate volunteering has several benefits for both businesses and organizations. In parallel, experienced and enthusiastic volunteers join NGO workers, enabling them to serve the community more effectively. Chezuba offers everyone looking to add purpose and meaning to their lives a chance to connect or volunteer virtually with nonprofit organizations from over 100 countries around the world. Visit www.chezuba.net and explore opportunities to find meaning. Chezuba, your platform to do good. And now, back with our guest.
I'm sure there are multiple challenges. Could you just share what is the biggest challenge that you're facing?
The biggest challenge at the moment is scaling. So when we think about our target market as 50% of the world, there's a lot of work to do. But really, we do know that the expertise is out there and they want to contribute it. So we are actually now well on our way to building a matching platform, if you will, similar to Uber or Airbnb, where you match the needs, with those that can fulfill it. And so that will allow us to reach many, many more clinics and hospitals throughout the world and really onboard many more healthcare providers. Right now, we work with physicians, but we are piloting a nursing program as well. And we expect
Okay.
our platform to enable, various healthcare provider professionals to work with us.
That's wonderful. That's very similar to what Chizuba is doing. What we do is we connect corporates, nonprofits, and volunteers, and connect them to each other. That is a very again, it's a SaaS platform.
That's a big piece of the puzzle, is making those connections.
Absolutely, so very important. When patients are enrolled in such a program, privacy or their information may get leaked. Do you have some kind of policies in place to ensure that this does not happen?
Absolutely. So, our technology, as you mentioned in the intro, I'm working with the World Health Organization on a roadmap of telehealth for the underserved. And when we started, there was no telehealth policy in most of the countries where we work because there was no telehealth. But as you know, certainly after COVID and when telehealth is more widely acceptable, those countries need to think about policy. And certainly at the core of that is patient protection. So we always operate at the highest standards that are used in, the US, where telehealth has been around for many, many years. And so we are HIPAA compliant and high trust certified and all of that to ensure that that patient data and their records are completely safe. And, again, we comply with the highest standards available.
Having said that, can you share any success story, something that has been particularly memorable or rewarding for you in your career so far?
There's so many success stories now that we've been doing it for 6 years or so. Um, One of my favorites is one of the first patients that I had the privilege of meeting, and she was a young woman, 19 years old, living in Malawi, and she had suffered from an obstetric fistula, which is an injury that occurs during childbirth. And it leaves a woman incontinent, and usually they are shamed from society, and maybe they live the rest of their life in a relative's back room, but it is absolutely unfathomable. And a couple of reasons that stands out is that women should be able to access appropriate maternal health care. And so, if she were able to have a C-section, she wouldn't have sustained that injury. And when that injury occurs, also the baby is usually stillborn, as was the case in her situation. So this young woman, 19 years old, which was the same age as my daughter, so it really impacted me, could lead a life of isolation. However, they have an obstetric surgery repair clinic in Malawi, but they had a hard time staffing it with experts from the US or Europe, and they would go as often as they can and do surgeries, but then they'd go back. So eventually they hired a surgeon that lived locally, but she still needed to grow in her profession. So for 2 years, we provided surgical mentoring of experts to that novice practitioner, and she grew in her practice to where she could perform many, many obstetric fistula surgeries and repair these women and give them their life back. And Sweet Esperanza was one of those very women. So she is kind of my champion that I always have in my mind,
Yeah.
as we go forward in this work.
So beautiful. And I'm sure she is thinking of you or giving back in her efforts as well.
She's amazing. She actually became an ambassador of the program because obstetric fistula is so stigmatized. People don't talk about
Stigmatized,
it
yeah.
and they don't know there's a chance for recovery. So she is kind of now an ambassador of that program and
How
tells women,
nice.
come to this site, and there is an amazing provider that does have all this support to make these life-changing surgeries.
Wow, isn't that wonderful? That's just beautiful. Now, this is one thing, and how do you address the potential disparity in access to, say, so people with limited digital literacy? Do you also train these people, or how do you get out?
Yes. So it's interesting because when we talk to partners or when the word gets out that we have, many people call them robots. It is a robotic device.
Mm.
And so when we say, "Oh, would you like one?" or how can we support you? And everyone wants a free robot, but then when it comes, then people just kind of look at it like, "Whoa, what are we going to do with it?"
Yeah.
It is so simple to use, and the way it's designed is phenomenal. So on site, they really just have to be there and make sure the device is on, And so it's very easy from that end. And even for the supporting providers, it again is just, putting, placing a few keystrokes. So, but for everybody that joins our program, we get them registered, and then we do like a 30-minute live simulation training for everyone. Because
Okay.
really, at the end of the day, we want the technology, as amazing as it is, we want it to melt away and to be, provider to provider, and have that, real personal connection. So it is amazingly easy to use. We support them every step of the way. We have a technical innovation center where they train the live simulation training, and then they're also able to continue to beam in there and to practice or even show their colleagues this technology. So we are, extremely fortunate, and again, that's through Teladoc Health as well, that they allow us to use their technical center.
That's super. Where do you see this organization going from now? 5 years down the line, 10 years down the line. What are you envisioning?
We have a big vision for sure. We want to enable a world in which all people have access to quality healthcare. And we're well on our way. It's very small now when you look at the scope of the situation. But with this platform, we will be able to dramatically affect the lives of millions of people. And so that's where we'll be, in the not too distant future.
That's great to know. I'm so glad I could connect with you and talk about your story and share the good work that you are doing on this podcast. Uh, Last question, Sharon, how can people help an organization like yours?
Well, there's a couple of ways. One is, on our website, you can sign up for our newsletter and stay engaged with us and see the work we're doing and become an ambassador of our work and evangelize it basically. And then if you're a healthcare provider, you can donate your time and expertise. And maybe that's an hour a month or something very small. Maybe it's an hour a week. So, we're very flexible with how providers engage with us. And finally, as a nonprofit, we do need to fund this work, and we need to, ship these devices to our partners. And so donations are actually, an incredible way to advance global healthcare.
Absolutely. Sharon, would you like to share anything else with us?
One thing that I just like to point out that's a little bit different than other organizations is that our underlying goal is always to upskill those local providers and really build the capacity of their health system so they can ensure that they're advancing patient healthcare in their own community. So we really take a back seat in this whole interaction, which is a little bit different.
That's wonderful. So basically, you're empowering them
That's
with
exactly
their, yes,
yeah.
and ensuring that the issues that they are facing, they find their own solutions to that with help from you.
That's exactly right. Which makes it more sustainable because as they become upskilled, they're able to do more and then support their own clinicians that may be underneath them. So it really creates kind of a ripple effect.
It's like training the trainer kind of program.
Exactly.
Wonderful. That's beautiful. It's extremely magnanimous of your organization to have some service like this. That's really beautiful. Thank you, Sharon, for sharing the stories of WTI and the wonderful work that you are doing.
It's been my pleasure. Thank you, Tej.